So good morning. Thank you all for being here to our session number 10 from the Research Data Management Workshop series that will go until December 12th. So we would like to start saying that we pay respect to the Algonquin people, who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. We acknowledge the traditional keepers, knowledge keepers, both young and old, and we honor the courageous leaders past, present, and future. I would like to remind you that we have one session still this week. This is an exception. So we'll have a session on Thursday about clinical trials and data sharing with Dr. Floriano did. And we go back to our normal schedule next Monday with Open Neuro with Dr. Russell Poldrek. If you would like to learn more about our initiatives and how you can become a data champion, please access our website and you can learn about what are our next steps, our next plans, and how you can join the team. So today we have the session titled Benefits of Open Data for Public Health with Dr. Manuel. Thank you so much for being here with us. This session usually takes around 40 minutes and we have 20 minutes for questions and answers. So we encourage everyone to place the questions in the chat, or after the presentation, you can also interact, open the mic and ask directly to Dr. Manuel. Thank you, Doug, so much for being here. We are very glad.
Okay, I'm taking away. Yeah. Okay, so today we're going to talk about open data and public health. I've got a bit too much, so I think if you came up here for the last part about seeing how we're trying to develop an open model for wastewater, I might disappoint you a bit, and I can always come back. But I think what we should do is go through. I think this is about really a bit of a discussion. I don't have all the answers for this. And so if you have questions or comments, please fire them off in the meeting chat, and I'll try to keep an eye on that, or Anna can keep an eye on that as well. And let's just keep on going through, and we'll take stock around 40 minutes and see whether we want to just stop and have a more formal discussion, or keep on going and see if we can't get into looking at how we're trying to build an open model for wastewater surveillance. Okay, so how's that sound? Let's go. Let's see. Okay, so my declaration is I'm employed by the Ottawa Hospital and University of Ottawa, the Ottawa Hospital Research Institute. I'm also been part-time at StatsCan for about 13, 14 years, and always been in government, actually, always kind of walked the walk and tried to work partly in government, partly in academia. And then I have been doing some consulting for World Bank and the Joint Research Center for the European Union around wastewater, and it's been really interesting in trying to develop wastewater internationally. Okay, so we're going to talk about some just like this is all kind of pandemic-y. So during the pandemic, what has it looked like in terms of public health data and data sharing and access? And I think we can still see examples, the full range. I'm more and more interested in organizational and cultural aspects, and I'm going to be talking about kind of my experiences and my experiences on the science table. I've been on, dozen or more committees at the federal level, provincial level, international level, trying to do modeling, using a lot of data for modeling, trying to help raise wastewater surveillance, et cetera. And so a lot of it's going to be kind of my personal experiences through there. And more I see this as sort of cultural and organizational more than technical. At least that's what I've heard. And then let's be positive too, because I think there's some strengths and weaknesses that can be easy to kind of get discouraged. And I think there's stuff that we can all do. And whether, no matter where you are on kind of the open science and the fair data. So I'm interested, I'm going to just kind of give what I've been trying to do. And I'm interested to hear what you've been trying to do as well. You can't see my slides yet. that right? Oh, hold on.
We don't see them.
Yeah. Okay, let me do that again. I think, yeah. You haven't missed anything yet. Slides. Here you go. And oops. Okay, that was my declarations, and these are the objectives. And then the third part would be more technical about open data model for public health surveillance wastewater. Okay, so I'm going to make a few introductory remarks. Maybe that we're all up to speed on this, but just sort of defining a few things: open science, fair data. And if you haven't seen it, I hadn't seen it until recently, but the Canadian Health Data Charter. So open science, this is straight from Wikipedia, and I like it. The title was this about open data, but I don't think we can talk about open data or data without talking about everything around it. You can't really have open data if you don't have have open source software. It's not really feasible. Or as well, you can have open data, but then you don't have open reports. So what good is that? So I think we need to think about not one aspect, but how this all puts together. Yeah, and I'm learning more from our Indigenous colleagues, and I am quite positive about OCAP principles, and so I like this because it has that on there as well. Our definition of open science, I'm sure we all have different definitions, but I kind of like the definition of that trying to make science, it's trying to make science so everyone can contribute to and benefit from science, and through, like I said, the whole research cycle. And please add comments if you have them. Let me see. Oh, I've lost my messages. Oh, I can't see my messages anymore now that I share the screen. Let's see. Okay, there we go. I can see the messages if anyone wants to add to this. And then FAIR principles, so findable, accessible, interoperable, and reusable. And these principles hold water for me. I think that these are the key principles I'm seeing, and if we are able to follow them, that I think we're getting to where the data can be used for public benefit. And Health Data Charter. So this is, I think, November 23rd, 2021, so a year old now. And I didn't really know about it until I did a panel recently. And what I like about this is it's framing data as a human right. And I was aware of this, and I love the idea that everyone has the right to benefit from science and benefit from non-discrimination. So like it's a UN human right. And I think bringing it back to kind of human right for me works. And so I'll introduce or talk about that a bit as we go through. So this is the first section. Has science changed in the pandemic? And if so, what is the role of open science and open data? And these are really my kind of more opinions. It's not, we haven't done a consensus on this, and I'm interested to hear what others say around this as well. And what I'm taking is actually, I've done a presentation or had discussions about this in a few different times, and I'm really showing what I had in those previous presentations. And it's interesting to see when we talk about how science has changed, where data fits on that and where open science fits on that. So here's a little bit of timeline, just kind of back through memory, and hopefully it's not too triggering. But we're just kind of the first year. And it's interesting to remember back. But, January 1st, I think it was January 1st, the first SARS-CoV-2 RNA was sequenced, and it was shared immediately and publicly. And one example I think for me is that did the people that sequenced that know about mRNA vaccinations? And because it was a new science as well. And because they were able to publish the sequence, then it was people were able to develop vaccines much more quickly than if we didn't have that. And just that one sequence and how it triggered and accelerated science because it was shared publicly. And it was from China. Sometimes we think of China as not the most open country, but the scientists there have done a tremendous effort to make some of these. You could argue that it should have been earlier, but just it's interesting, just that one piece of open data and how it triggered so much. We had these SEIR models being shared publicly, and now the world knows about COVID modeling, and the data, that information that went into that. And at the beginning of the pandemic, remember, like I'm in Ottawa, and it was like 99%, the polls were like 99% of people support restrictions, the lockdown initially, because you had, New York and Italy really crashing, or struggling with a very difficult time, and then these models after models showing that other countries were going to be the same if we weren't able to slow it down. And so these open models and open sharing of models were really doing a lot of uptake. And then, what PCR testing. And, I don't think we've ever seen anything like PCR testing. And it's taken a while, but now we have sequencing and PCR testing data worldwide informing, variants. And I'm going to show a bit more about that. Aggregator sites, Teresa Tam was really getting a lot of information from, because a PhD student in Toronto was aggregating data in Canada, and the public health agencies were really struggling with getting the data. And you had these new innovative approach to scrape data and aggregate them that were popping up in Johns Hopkins, our world data, and in Canada as well. And I think this has been defining for us. I don't really think that we've seen anything quite like that before. Wastewater testing, a new system of wastewater quite early. We had these scientific debates. I was part of the Ontario Science Advisory Table, and I can tell you it was very good. We were very open about everything that we did, and I think there was sometimes tensions. People, what was it? The Toronto Sun. It was a doctatorship. That the doctors, the scientists were having too much say. The science table wasn't able to enact any policy, but because they were at these presentations with the Chief Medical Officer of Health or Premier, and because I think in part because it was so open that it resonated. And I'm going to talk a bit more about that. Then RNA vaccines, and then and then the whole idea of preprints. 100,000 papers in the first year, and 30 and preprints were 30% of those. So preprints were in other fields, but I think in our field, some of our fields, we weren't really using preprints before, but now it's changed quite a bit. So I'll pause there. That's just trying to set the tone for the next sort of 20 minutes discussion. Any comments? No, I'll keep on going. So I have three groups here. How science advanced, and kind of group number one is science disciplines that had important or major advances during the pandemic. How we actually perform science, and then sort of policy, how science informed policy in society. So those three kind of groups, these are a little bit overlapping, like some appear in more than one, and they're not really distinct in some ways, but these are some musings, if nothing else. So I should kind of go back and let you folks think for almost do that, like let you think for a bit and start firing off them in the message, because I really would like to hear what you think. And because I think these are ones that I've thought about myself, but again, like we haven't had really consensus meeting about this. But mRNA vaccines, I think we need to agree on that one. Everyone knows about PCR testing now. And one of the first real major advances in genomics, I think that's really, genomics has had some difficulties sort of getting impact in the clinical space, but this is definitely one of them. Everyone knows about modeling. I'd be a bit biased, but I think wastewater surveillance is now on the radar and may be, is going to be one of our new public health surveillance tools this century. I put down here big data, population health, and epidemiology. I don't know if it's had a major advance in terms of the science, but in the practice it has. And like I was saying about the data repositories, and in some ways how data has been available. Remember that we even today, in our world of data, you see these waves of new variants coming at us because the data is almost real time in Europe and other places, and you can and then we follow the Earth a lot of the time, so we have this sort of a little bit of advance warning. And this time last year, we started having these frantic meetings at the science table, trying to get our eyes on Omicron, and seeing South Africa having a lot of difficulties. And calling them up, and science by Twitter. I'm going to talk a bit about that as well. But the practice and the speed of information sharing worldwide, I think we can agree, was really interesting, really impactful. The social mention groups are a bit on here, partly for me, they're notable, or special mentions are notables. For me, I really feel that that we've undercommitted ourselves in Canada's social sciences for the past forever. And, I sort of say the pandemic is about two organisms, SARS-CoV-2 and Homo sapiens. And over 2 years, we know more about one than the other. And the one that we know more about is SARS-CoV-2. We still don't know ourselves. And a lot of the data, health behavior data, never reached public space. So when the science table was disbanded, we were almost at the point where we were able to get the government polling. But, and the people that were involved in the Ministry of Health in Ontario were quite aware and interested in getting that data to the health behavior subgroup of the science table. But it was very difficult. That data was considered polling data for government and not science data. And so throughout the pandemic, I think that we were lacking information about ourselves and how we interact and how we support or don't support policy. And that affected the quality of the policy. I view the convoy as a preventable event. As a public health physician, it was a preventable event. And I think I could have done better, being aware of different social attitudes and receptivity and engagement, making sure people are engaged. And, I think that we can even speculate, would we have a war in Ukraine now if it wasn't for is it that what we see often is social change coming out of pandemics. In India, 20 million people died in the influenza pandemic in 1970, 1980. And then people sort of make linkages of that to Gandhi, the rise of Gandhi and the Indian revolution. So pandemics in society are massive. And I think this was a bit of a missed opportunity for us. And then precision health, artificial intelligence, and e-health applications. I think we had great hope for them, but I'm not sure we've seen that yet. Group number 2 is how science is performed. So open science, I think, has accelerated during the pandemic, and with things like preprints. And in a lot of my fields in public health or epidemiology or modeling, it's becoming now pretty common to see people's code on GitHub. That said, there's a lot of papers in Canada where they say see GitHub, or we're going to put our code on GitHub, and it's never arrived. But more use of open languages like R, more use of publishing code, and more preprints. I think this may disagree on this, but I think there's some suggestions or hints that we're having more large multidisciplinary international collaborations. Some of those are consensus development, and when they're happening, the science is getting better. So things like the debates around whether masks work and whether SARS-CoV-2 is aerosolized. Modeling studies, there's a study in Nature suggesting that consensus building and modeling improves modeling. I found myself, like at the science table, we can all be outliers. And I was trying to kind of keep track of myself. Like, if I'm an outlier, I'll say something and people say, no, I don't think that's right. And I'll maybe give a second push on it. And no, it's not sticking. And then I'll kind of quiet it down, because if I'm an outlier, I think that my thinking is, you can be a genius every once in a while, but most of the time you're just an outlier, and we need to kind of go more with the consensus, because if you have a rich, proper discussion with good science consensus and good science processes for that, the consensus is usually better than the individual. And I think we're seeing this, things like the science table and SAGE and modeling groups internationally. And I hope we'll see more of this. Data aggregators, I think are hopefully here for now. And then Science by Twitter, I think, is sort of special mention one. So here's just one or two little slides, but this is from 2020. Just the growth of science is just phenomenal. And then that blue line is the preprints. Oh, Julian, agree that there's still constraints in the data availability and behaviors because of jurisdictions. What about the use of data shield? Yeah, I haven't thought of that. And maybe if you could write a bit more about that in there, that would be good. Or maybe do you want to make a comment, Julian?
Doug, it was just as you were speaking and thinking about things, Data Shield came to mind. And I mean, I have heard from various people, because we work on variants of concern and vaccine effectiveness and links with modeling groups on that. They mentioned data sharing as still a major problem in that area, and a major frustration. And I mean, it strikes me that some of the, the debate that's happening now kind of was held about 10 years ago in relation to putting cohort studies together. And that's kind of where Data Shield emerged as coordinated iteration across jurisdictions. So if you couldn't have data leave a jurisdiction, you could still actually work with that data by having a central model and sending stuff back and forth. And I mean, I've been thinking about it again, because I'm thinking about doing some work and updating work I did 30 years ago on childhood cancer. And a point was brought up to me that actually for cancer registration data internationally, IARC and LEON is having more and more problems about sharing of data. It's not the environment it was 30 years ago. I brought up Data Shield in that context, and the response came back, yeah, we've thought about it, but we're not sure it works with less common conditions. So I was just interested if Data Shield had been thought about at all in terms of trying to encourage exchange of data if you couldn't do it directly.
Well, I think, like what I've seen too, working with Europe, I think one thing is just being clear about what you can or can't share.
Yeah.
And it's usually a layered approach. And so in Europe, for say wastewater, and their general approach, I think in the European Union is sort of three different major layers. Try to get some stuff out, but that could be quite thin, like our world and data sort of stuff. It could be aggregate, and so I'm going to talk about this too. Is like, I think one of the things we need to think about is like kind of how we can do a little bit more tomorrow compared to today. And if we and if we can share a bit more data, and I sort of say sometimes too, like just even the metadata, or just even know that the data is available, or an abstract. anything, I think, and I think sometimes we try to make it too big a leap. And because, I think one what I found too during the pandemic, like say the wastewater in Ottawa, we've had, 1.5 million views on 613 COVID, and that's just a small part of it. But initially there was always hesitancy, but once you put it on there, you talk with Rob Deltola, who's collected the data, and he, he'll say he need a little, he was a little bit nervous, but he'll also say nothing has happened in 2 years. There's been the only complaints we get is when the website's down. I think it's down right now. And that we get complaints the data is not available. And for him as a researcher too, it's allowed him to meet a lot of other disciplines work, and he has more research papers as opposed to fewer. People aren't sharing data because they're afraid they're going to get scooped on research. And usually it's never that way. In my experience, it's never that way, that you get more research opportunities as well. So anyways, I think kind of getting started in layered approach for data access.
Okay, thank you.
We'll talk a bit more, but science informed policy. So science by Twitter. I talked about the role of modeling. I think we've made some progress in equity and diversity, like sort of having science, more information over the pandemic around racialized groups and equity and diversity. And I don't think we're going to go back. And I think science advisory tables, they're interesting. We remember that we've dropped pretty much them now internationally. And I've met a lot of scientists that just don't want to go back. Like we had difficulties sometimes with some government or some advisory groups. If it wasn't clear about how open you could be, people won't participate now. And I'm finding that myself as well. So are we going to have a movement to scientists sort of have really requesting and wanting to have more open committees when they're participating in science advisory tables or science advisory groups? And then special mention would be science and government agencies. I'd like to acknowledge that everyone was working incredibly hard and doing a lot of work, but still sometimes wonder if we've fallen short of what we could have achieved or could be achieving. And I think a lot of folks here in Canada on this call, if you look at what was coming out of Public Health Agency of Canada and look at other countries, I think you have to come with the conclusion that there was less information from Public Health Agency of Canada compared to other national agencies. That doesn't mean like all is lost, because we still had a lot of a lot of scientists filled some of that role, and citizen scientists and media and others. So we were getting a lot of models, for instance, but we weren't necessarily seeing the fact models all the time. So kind of special mention to government. Yeah, patient advocacy and patient-driven research. That's a good point, and let's put that one on the list. I think we should do that. Okay. This is just someone from Twitter sort of talking about how they found Twitter during the pandemic, and more visible, more collaborative. I can tell you, like the principle of Chatham House rules that you don't name individuals, and I'm going to kind of break the rule, but I've talked to Peter Uni about this because I think it's helpful to sort of just have the name. But this time last year, I think it was beginning of December, we'd have a meeting at the science table, and Peter started saying, like, everything I'm going to show, and he would have a presentation about the evidence of Omicron. He says, everything I'm going to show is from Twitter, and it wasn't quite true. But what Peter did, because he did show some other information, but point well taken. And what he did when he was pointing to summaries from Twitter, he put the Twitter handle up on the PowerPoint slide in the top right. And we knew who those were. They were our colleagues, or someone at the table knew them and could speak to their experience or the context around that, and included a lot of folks from South Africa. And then we would see the tweets from them, and then we'd say, does anyone know them? And inevitably someone on the science table would know them. and we would invite them to the next meeting. And so it was interesting, so I think for all of us, there was a credible part of science where it's backed up by some, by it's not, you're not using it by itself, that 120 words or whatever it is, but you're putting in context by who was it, what did they post on that, and et cetera. But I think as scientists, we were using it a lot. And it's interesting to think about where we are now with it. I've joined Mastodon. I tweeted out that, Yuval Harari was saying Twitter was a gladiator pit. I think we can see the upside and downside of Twitter. But I think that I'm wondering where we're going to be 5 years from now. Is Twitter going to be around? Are we all going to be on Mastodon? Is that going to work? I don't know. But open tweets. This is just shout out for trust and how trust is related to open data. And so there's a few of these studies that show that countries that had higher interpersonal trust or higher trust with government have done, like, it's basically the largest predictor of success, accounting for whether you're an island. And like, there's a very good study that was from the World Wellbeing Index, and Canadians that did it, but using the data within the World Being Index to show the sort of same information, that interpersonal trust or government trust within communities was positively associated with better COVID outcomes during the pandemic. I'm not an expert on trust, but it's one of the key concepts, it seems to me, for trust is openness. You're transparent. Government is transparent, or you're transparent. Openness, transparency, data, open science. So, open government, open policy. And I think we're at the situation where we need to pay attention to trust, in the sense that, and openness, if it is a positive metric for our society, now we're starting to get some pretty big imperatives for open science, if it's related to trust, and if trust is related to success in the pandemic. Okay, so I'm going to talk about two examples, and I'm nervous about this. And it's interesting that I'm nervous. I'm a full professor, and I'm nervous about being transparent and talking about some of these experiences as well, because I'm worried that I'm worried that people won't want to work with me. I'm worried that I'm going to violate some trust in some conversations. I'm worried. I work at StatsCan. I'm worried that I'm going to be maybe portrayed as being critical of government or Statistics Canada. And I recognize that I'm have concerns and shyness about this, then where are our younger investigators? I appear to be a white male. What about our racialized groups? And so, I think it's really notable that I'm nervous about kind of talking about this. And I hope this is going to be, everyone involved would say, no, you're being fair, or this is helpful. But I'm not sure. So some parts are maybe a little bit critical here. So where are we? So yeah. So for the national modeling, we have sort of stakeholders from across Canada that are doing modeling, and we would see the fact reports that they would generate fairly often. They're about like 100 pages long, excellent reports. And I would ask on more than one occasion, like, can I share this? And I look at the report, and there's nothing private or confidential in there. It's all aggregate data, and it was really like critical information that I was getting. And I'd be in the news a lot as well. And can I talk about this in the news? Like, one of the things about news for me, I was trying to be very just tell people what I know. And I feel quite uncomfortable when I know things that I'm not sure if I can talk about. And I was told, no, Doug, you can't share this. This is just for you right now, period. And wonderful people working very hard. And And we would ask a few times, and after a while, you don't ask. And so we have a national public health agency who is really concerned they're not getting data during the pandemic. But then when they get the data and they use the data, how much are they passing it on to others? And it's difficult to share data if you don't see the benefit from you as a province or scientist, or you can't use that information. And so it's not only about the data, it's about the pipeline. And what concerned me about that too is that I didn't know why I couldn't share it. And I was just sort of told not at this time. And, was there something confidential in there? There was sensitive information, like sometimes there's transportation information. There might be modeling that has used data from TELUS, cell phone data. I don't know. But if it was, then I was like, take that part out, and release some parts. And I still don't know why we couldn't share that information. And it was fantastic information. So I think that's COVID modeling, and not data, right? But information, but on the data pipeline. So wastewater surveillance is an interesting one as well. We have, because when we were starting to develop this, I was thinking that this is our opportunity. It's the new data, it's aggregate data, it's like walkability, it's aggregate data you can't uniquely identify. REBs don't want to even, they say we don't need to review the application. And it was a new system. So I thought, okay, here we're unencumbered by previous data sharing agreements. We can start this one from scratch. And so where are we? I think in Ontario, for instance, we have about 170 sites that are being tested by 13 labs. And do you even know that? I don't know where the 170 sites are, and I've been helping develop the program for quite some time. I know who the labs are. And that data is not available. We paid $47 million for it. And the data sharing agreement is largely states that the laboratories who have been testing, the academic laboratories who have been testing it, are the data owners, and it's up to them to decide how it's being shared. And the ministry who's paying for it, Ministry of Environment, Conservation and Parks, has some data use and they can transfer it, but it's a little bit unclear. And so it's difficult to access the data. Now there's a silver lining. As of last week, the 13 labs have endorsed FAIR principles, and they're going to make the data available. So they've officially sort of trying to make that data available. Surely the data owners are the public and the patients. I think one of the challenges with wastewater data, I sort of say there's three major partners, and maybe this is maybe unkind, but wastewater labs, the communities, and the municipality, and then you have the funders as well. And it's sort of like that who's on first, what's on second. Like you talk with one person, they say, oh, it's not my data, it's the city's data. And then you go to the city, it's like, not my data, it's the lab's data. And you can't, why can't we just get everyone in the table at the same time, like on the call, and figure this out? And when you do that, then there's other barriers that come up. And so data ownership is an interesting challenge sometimes, and who owns the data. And maybe I'll just pause there. I won't say too much more at this point, because I think that let's get back to that one. Or that's David, if you have any. So David's comment was, surely data owners are the public and the patients. David, do you want to make any comments, or you're happy to go forward? Like we can continue on and get back to that?
Well, I mean, I want to obviously let you continue with a very thought-provoking session. But I think sort of writ large, I think we know probably two things, not just public health, but I think patients or the public own the data, and patients are very clear that they want the data shared. And I think it's somewhat paternalistic to not honor, for example, in a clinical trial. The only way the trialists have the data is because the patient agrees to participate in the trial. And they want the data shared. I mean, there's accumulating evidence about this, and I feel it's sort of very, I don't know, hierarchical. It's sort of weird that people don't honor that.
Yeah.
So I hear these scientists say, it's my data. It's not. You only have the data because someone gave it to you. You don't have the data because you got it.
Yeah, like let's talk about this more. I think this is where, and I'll move forward. And this is one of the reasons why I like the health data charter as well. And that's very much entrenched in there. But, so remember that I would be, I would be at meetings and sort of like, okay, let's make the data open, wastewater data open. And people didn't respond really, and they don't sort of would say why that they wouldn't want to do that. And then you talk more, and there's a lot of things that come up. Now, here's a list. I've heard all of these things on the right-hand side multiple times in multiple settings. So it's not one specialty, it's not one university, it's not universities, it's also government. And you hear these, and I think that these are all legitimate reasons. Like, I think we need to listen to these reasons about why people say it's my data, or I'm not ready to make make that report, or Doug, we can't share that modeling report right now. This is actually, the quotes are, this has been written. There's a paper here that's reviewed this as well, and interviewed people as well. But these are things that I heard quite often. Again, I didn't hear, we don't have a standard data format, or we don't have, a server that can hold the data. I didn't hear technical reasons, or I didn't, you'd hear sometimes data sharing agreements, but it was normally around lack of clarity of the data sharing agreement. Like the lack of guidelines. It's not my data to share, or I'm not sure whose data it is. So I think that these are all completely legitimate reasons. And again, I think that if we don't address these reasons, that we won't be able to move forward. And so we have 3 reports from the National Health Data Strategy. I think they're really strong reports, and something that I would write as well. But these are light in the report. These issues are light in the report, and I think that these are, this is what I saw over the last 2 years. With respect, this is 2014, much has happened in intervening years. I've heard these the last 2 years. This is all the last 2 years. But David, are you saying like this, we shouldn't be hearing this now? We've moved on, like this is acceptable to hear in 2014 and not 2022?
Yeah, I think I'm saying that because the world, obviously COVID is one example, but there's, between 2014 and the subsequent 8 years, I think there's an enormous amount of change, in that the fact that you're hearing this suggests that, it suggests to me at least, that there has been no change in these circles here.
Yeah, I think, I would sometimes hear, you could hear half a dozen of these in 1 minute, as well. And so I don't want to say that it wasn't uncommon as well. Like I would say when, that example that I had with let's say the modeling reports, it was sort of not lack of guidelines. It was it's like not ready. Like this is work in progress, and we're planning to publish this, but it's not ready yet. So I think that it was pretty common during the pandemic. And again, like it's not one person. This is it's not government. It's also academics. Yeah. Now, I think if you, like, I think if you go on, my partner's a psychologist, so maybe I get a little bit more of this, and I'm not sure if they would be 100% happy with me saying that they've influenced this, but as a psychologist, when you look at those, you sort of see the needs and maladaptive responses. And I wonder if, part of this is we have sort of maladaptive organizational responses, and we also have needs that are not being met. So needs are in the green and maladaptive responses are in the red. So, like I said, I have a maladaptive response. I've been nervous about talking about this. I don't have confidence. I'm not sure if I feel safe. I'm not sure if, so even for me, when at this presentation, I'm hesitant. And that if you publish something that it shows is too early, you're going to have that shame and that guilt, and you're going to feel anxious about it and maybe fearful. If you have, there are always risks with making data public. And if you do that and harms will happen, then you fear that, and you will feel guilt from that. When I was just in Europe, we were talking about trying to get data open. People were giving examples like, I don't know if this is, I tried to verify this, and the person who was an expert in this was talking about it, but George Clooney's trust, they were using satellite imaging in Sudan to try to raise awareness of the villages that were being burned, and people being killed. And apparently, and so that was open data, like that's data that anyone can get, and they were aggregating it, making it available. And apparently the Sudanese government was using that to find villages that weren't burned and targeting those villages. So, open data, good intentions can go wrong. And then that becomes a big barrier, especially if you don't have support for that. So I think these are this is what I'm seeing, that our organizations and our cultures there's gaps, I think, between how we're organizing ourselves and how it's affecting how we conduct research and be open with research. What can you do? These are things that I've been doing, and I'm gonna, please add to this, or and like I want to be positive about this. But David, I try not to call it my data, or like I try not, like I work at StatsCan, and if you won't, I don't think you'll hear me say StatsCan's data. I'll say data collected by StatsCan, or I work at ICS, and that's where I conduct a lot of research. I won't say ICIS's data. I'll say data housed at ICIS, and I'll have a couple more examples of that. And I think there's a difference between ownership, custodianship, and stewardship. And you need to think about where you're an owner, whether like how much is ownership, how much it's stewardship, how much is custodianship. I think if you're, actually, I'm going to go through these quickly because I have slides for each one. Chatham House rules, I think setting the tone, and that is one thing. If you do that at your meetings, research groups, we've now incorporated, I have terms of reference for my larger research groups and projects, and we specifically talk about how you can talk about the research and meetings that we're doing, and basically following Chatham House rules. This means that you can say stuff, but you just can't accredit to individuals, and it doesn't mean everything. Like at the science table, we would sometimes have discussions about racialized groups and see information about that, and those groups would say, we're not ready to talk with, or we need to talk with our communities first. Fine. But if you start off in your terms of reference with something like Chatham House rules, it will change. It has changed the way that we conduct our meetings and share information. Health data charter, I'll talk about that. I think we need to have better acknowledgement, reward, and support for people's efforts on an individual and institutional level. I try to recognize that that I can't imagine the value of the data, like that. It's just not possible. That there's going to be uses that are valuable and helpful that are beyond my imagination. And I think the example of the sequencing SARS-CoV-2 is that. If you can't share the data, then be specific. Or if you can't share the report, then be specific. Just don't say, I can't, or don't say nothing, say why. Because if you say why, then you can talk about that. It's not my data, or there's privacy concerns, or I'm concerned that there's going to be harms. Then you can start talking about that. And I think it's our duty as scientists and to engage in that as well, to be respectful, but to say, to respond like, well, I think there's more benefits than harms. So, and not have the veto, but discuss that. And then I think practice a little bit more open science today than you did yesterday. And the example for this I have, when I lived in Toronto, I said to a friend once, traffic was terrible in Toronto. And I said, like, well, when I'm driving, I try to let one more car in that lets me in the traffic. And he said, oh, so you just let one car in your whole trip, meaning that, no one in Toronto would ever let you in. And, I think it's kind of like that. Like we want to be like one more kind of open-y and then like, so if you receive the data, try to send it along in a happy way as well. So try not to call the data your own. Ask yourself whether you're the owner of the data, whether like if it's a human study, like maybe if it's about planets, you can say I own the data. But I think if it's a human study or community study, it's difficult to say that you're the sole owner. Like you're maybe you collected it, but how much do you own it? How much are you the custodian or the steward of it, of other people's data? So like what David was saying. And so, even these small things, instead of saying my data, say like, the COVID studies data or data housed at Stats Canada. And I think even like, instead of saying Ontario's data, say Ontarians' data, changing 2 letters, changes the dialogue. So then it's not this political, like politics, it doesn't become government's data, but it becomes the people who live in Ontario's data. And I found when I've started doing this, it changes the way I think about the data and have it more patient-oriented or person-oriented or community-oriented. Chatham House rules. I think I've talked about this, but basically the idea that start your discussions off by saying, agreeing to what you can and can't talk about, and default to being open and establish that. And with your research study as well. And basically Chatham House Rule says like, let's have an open discussion. The discussion is about with individuals, so you don't have to represent your institution or your discipline. But the idea is that you don't then link that discussion back to individual person. Health Data Charter. So your data is a human right for you to benefit from your data. And this is a bit wordy, but the idea here is that it becomes an imperative of human right. And the idea with the Health Data Charter is that people are at the center of data, and that it's your data. You should have timely access to it, or also you should benefit from it, being able to have it used in research or policy or others. Health literacy is part of this, and then special mention to Indigenous populations. I think, I think we need, personally, I think we need to have people involved with the data pipeline recognize more in research publications or more publicly. I think we need to have open science sections in our CVs, and those be recognized by our institutes. Putting just even identifiers so it can be more findable, everything, code, data. I think we need to recognize this is difficult for a lot of people or everyone. Just recognize it. And then I think that we need to support people, both like, supportive environments, not only money, but we do need money as well. Recognize the data will grow. So, that one sequencing at the beginning, and now we have like Cancogene in Canada, and worldwide, there's a lot more sequencing data. And it took a while to do, but now you see things like on the right-hand side, really being able to describe the pandemic in ways that we weren't before. And I like on the left, this is COVAR publication, but on the left, it starts off contributing authors, it acknowledges the funders. The bottom line there is important caveats and disclaimers. We have 5 minutes left. Yes, let's stop. I think everything I have here, I've mentioned quickly. If you can't share the data, be specific. Be a little bit more open today. So if you can't share the data, share the metadata. If you can't share the code, share part of your code. If you can't share the port repair summary, just try to keep the open science part. Just do a bit more than you did yesterday. And I'll stop there.
Thank you so much, Doug. Very thought-provoking for sure. We essentially have 3 minutes left, and I wanted to ask the participants whether they have anything they would like to comment or ask Doug. I would have been happy to hear you myself, Doug, for the next hour, but I recognize we only have 1 hour and that people have other things to do. So any comments or questions for Doug in these last few minutes? Obviously, Doug, well, I'll just jump in and say, I think the whole idea that you mentioned about trust is such a critical issue, and that I think that it sort of undermines science writ large. Actually, if we don't have trust, then we're not going to believe what people say, and it's going to be much more difficult to disseminate anything that happens. So it seems to be the trust is incredibly important.
I've been thinking a lot more about trust as the pandemic's gone through, and starting to read more about it, how we can, like what it means, like what it composed, how we can create it, how can it be broken down. Yeah, so I don't, it's not my area, but I agree with you, David. I've been, it's definitely on the radar.
Okay, well, I think the feedback that I'm just reading here is very thought-provoking, and I'm going to have to find a venue for you to come back and talk, because it's so interesting. So interesting.
I love to come back and talk about the data model too, like what we've been trying to do to build some of it in there to address this as well. But yeah,
we'll find a way to do that, Doug. And I just want to thank you once again for first of all, for your time today. But obviously today represents many thousands of hours, no doubt, of thinking about these things and participating in meetings. So we're the lucky people to get the output from you. So I wanted to wish everybody also a wonderful day, and thanks for coming on, and thank you again, Doug.
Thanks for having me. Yeah.
Take care.